Believe it or not, there may be a cure for Shopaholics. It is a pill originally made to treat Alzheimer's disease.
Researchers say compulsive shoppers who took the pill spent less time shopping and cut the cash they spent on impulse buys. Joining us now is Dr. Jonathan Fellus, a neurologist from Meadowlands Hospital in New Jersey. Good morning, Dr. Fellus. First of all, what is this pill, and is there really a similarity between Shopaholics and Alzheimer's patients?
So first of all, this pill is memantine, is a generic name, Namenda the brand name, and it works by jumping into the abnormal chemistry. There's an imbalance of chemistry in patients with Alzheimer's, these chemical and electrical signals in the brain, and so this drug jumps in to rebalance them, protecting brain cells so the brain cells don't die and overheat, but also sharpening the signal and fine-tuning the signal in the brain, and all of this leads to clearer thinking in patients with Alzheimer's.
What is the connection then from Alzheimer's to being a shopaholic?
Right. So even patients with Alzheimer's have some compulsive behaviors. They may yell out, grab things. They may cry even though they're not depressed. So the connection is there's similar chemistry in Shopaholics where they have this impulse or compulsive behavior to shop.
What were the researchers actually looking for when they started this? I assume they weren't trying to cure shopaholics.
Well, we don't know originally who had the idea, but the fact is that what's being published in the news is this study in 9 patients who were diagnosed as having obsessive compulsive shopping disorder. They were given this drug Namenda for 8 weeks, and the researchers looked at what their behavior was.
You bring up the obsessive compulsive disorder of being a shopaholic, and I wonder how much could this drug potentially go towards helping people with broader obsessive compulsive disorders, perhaps the kind that can't just be stopped by putting the credit card away?
So I don't think we know that yet. This was a small study, and it did reduce their amount of shopping and the amount of time they spent thinking about shopping by about half, and it changed some of their brain chemistry according to some tests that they did. But we really don't know the answer yet about bigger studies need to be done, and it would need to be done on other types of people who have different kinds of obsessive compulsive behavior.
It actually reduced their shopping by about half?
Yes, that's correct.
That's a big number.
Yeah, it is. It's exciting.
Depends on your point of view, I guess.
Well,
do you have to
not good for the economy.
Yeah, I know, exactly.
Right.
Do you have to keep using it?
Yes. You mentioned the word cure, and there are very few cures in brain diseases and psychiatric disorders. We're talking here about managing this disorder over the long term. It's not like taking an antibiotic for pneumonia and it goes away and you stop taking the antibiotic. You have to take this medication probably for a long, long time. Of course, it's better to get counseling as well as drug therapy because the two work better together.
Side effects? Generally
well tolerated. This is a medication you have to remember that's generally being given to patients with Alzheimer's. They're older. This is very well tolerated. It's been around a long time. There were no real significant side effects in this small study.
Fascinating. Dr. Jonathan Fellus, thank you.
You're welcome.